Dr. Deepika, are
You
you
are
able
not
to hear
audible.
me?
Yes, yes. Now you're
Yes,
audible.
Dr.
Thank you for the
Yeah.
introduction, Richa.
Very good evening, ma'am. Welcome you to our show.
Thank you.
So, ma'am, first of all, I would request you to please let our viewers know that what is the importance of this topic and why we are actually discussing on this topic today.
Sure. Actually, the first thing I would like to tell everyone that we are right now we are in this 21st century with all the latest technologies, advances all around us, and this has transformed the experience of having a baby to a pregnant woman, right? But in spite of all these, there are certain age-old beliefs, age-old what we beliefs, and because they don't have any scientific basis, so we call them as myths, which are already prevailing around us, despite of being in 21st century, and it might go the same in the future. And why we are discussing here is the reason why, as I said, there is no scientific basis for that, as well as they all actually make you worry unnecessarily. So, even though you know everything, but a woman who becomes pregnant or who conceives have certain, some background. Certain background stress or stress, or they are told, or they are being so deep rooted, these myths, that even an intellectual or intelligent woman who is well educated and who is working would still start believing in these things, because you don't want anything bad for the baby. You start thinking everything, that you want to do everything good for the baby as much as possible. But there are certain things that certain these beliefs make you worry unnecessarily, because they give you certain baseless facts, baseless things that makes you believe something is wrong, and then you have to be extra cautious. Coming to the IVF pregnancy, every woman who becomes pregnant it is definitely precious for the person, but who have undergone IVF, that is an extra procedure for conceiving, they already know that it is way precious for them, and that's why the person himself or herself, as well as the people around her family, they make their aim to be as cautious as possible, but that adds to your worries rather than enjoying this precious 9 months of your lifetime. So I am here to clear the minds also, that what you need to believe, and what you need not to believe, and what all to be done to be healthy, but living healthy and enjoying it as at the same time is more important, rather than just that you have conceived and you have to worry for the whole next 9 months. It doesn't have any such effect like that. So there are certain examples, we would be discussing it further also, but as I would add, first thing is that once you conceive, you are told that there is no need for exercise right now. You are just supposed to eat, eating for two. This is again, eating for two is something which is not a actual basic thing. Eating for two, that you are there is a different person growing inside you, the baby is growing inside you, but that baby is not an adult that you have to double your diet. The first 3 months are already problematic to the patient, because they have nausea, vomiting sensations. So out of that, definitely you have to start eating healthy, and just 300 to 500 kilocalories per day is the additional requirement as the pregnancy demands. Secondly, also again, you don't have to exercise at all for the 9 months. It doesn't have any scientific basis, because better to exercises. There is no heavy strenuous exercise, lifting or skipping or jumping or jogging, but there are certain stretching exercises, yoga, breathing exercises, which are very helpful for the reduce the muscle spasms that one undergoes already because of the growing tummy, change in your back curvature, making your muscles taut, your back muscles also. So it is very helpful also for the proper positioning of the baby. Then they are very once listening to them, they sound very funny, but actually the people, and as we being an infertility specialist and seeing all the IVF pregnancies as well as the normal pregnancies, routine pregnancies also, I come across so much very like different beliefs of the people, and they sound very sometimes funny also, but they start believing those. Like for example, you are not supposed to touch your tummy. It is very it doesn't make any sense, but that makes it even a slight touch to the tummy might affect your baby. How it is possible? It is your skin, and then the baby is inside your uterus with the fluid around it, and there is n number of cushioning around the baby. Then it's your uterus, peritoneum, your fat layer, and everything. So this touch is not going to harm, but how it affects the patient is they stop they just start being so cautious that they avoid wearing there are very simple things, but they avoid wearing anything over their tummy. So there are certain patients who avoid wearing the undergarments also, that okay, this is going to suffocate the baby or something like that. Then no need to scrub your body while taking bath, you just put water. All these things would add to your infection, or there would be a layer of impurity, or like dust, or everything would start accumulating on your tummy, and that is also one of the reason that you start having discoloration, and it adds up to your infection possibilities also. Then there are simple things like don't consume dark foods. That many of the people you hear that dark food would make the baby look dark. Avoid black coffee, black tea, or in fact tea also. Of course, excessive amount of tea, coffee is not at all advisable, but a certain once or twice in a day is okay. And again, saffron milk, kesar wala milk is very good for the baby. It make your baby look fair and good. Again, it is nothing like that. The complexion of the baby or the facial features of the baby is completely inherited. It depends on the genes, and your intake of food is not going to affect the look of the baby or the complexion of the baby. Then many more, I can go on about it, but
Yeah,
there are
yeah.
one or two things where very, it doesn't carry any importance, but you still have still make the person follow them, and we can still discuss it further as we
Very
go with
true,
the
Dr.
discussion.
Deepika. And one thing you said very to the point, doctor, that when it comes to having your own baby, then not only the mother but the whole family is extra cautious about it.
Yes,
And when we talk about IVF pregnancy, then there are so many things attached to it that many things your friends will be suggesting, so many things your own family members will be suggesting, whether it is logical or it is illogical. Then also, out of extra cautiousness, we listen to it, we give our ears to it, and we try, start making it more and more safe.
yes,
So doctor, to start our discussion with, there are few I can say myths which are very much relevant in Indian society. So I would like to you to clarify on it, ma'am, one on one. So doctor, my first
sure.
question will be like, is IVF pregnancy complicated? Means is it similar, or is it different to the natural pregnancy?
As I have just started with my discussion, was that precious. We call it more precious. Why? Because a couple has already waited. They underwent a infertility. They underwent a period of infertility. Infertility as in not able to conceive. And after that, after treatment, and IVF being the advanced treatment, the most advanced treatment in the in terms of infertility treatment, after that they have conceived. That makes it more precious, because there was very less chance of you becoming possibility of conceiving, and then you have conceived after all the treatment with all the advances of treatment. So now you have to be extra cautious. It's not complicated every time as it is seen that IVF pregnancy is something very complicated, and then now, as I mentioned earlier, that you have to rest for whole 9 months. You cannot move out of the bed. Nothing like that. Definitely, it is something very different, that we have to be. There are certain medications that are added other than a normal pregnancy. There are certain tests which are other than routine pregnancy, or there is you are asked to follow up with the doctor more frequently as compared to a normal pregnancy, and certain slightly different ways medications also, and that's it. That suffice enough. You don't have to make it a that big a problem, that as you said, that IVF pregnancy, and then hearing to other people around you that I have underwent this and that, and because they share their experiences. But these are not very complicated. There are possibility of complications definitely with IVF pregnancy, but not it is not a complicated pregnancy. It is just to be it is just a precious pregnancy. I would label it as a precious pregnancy.
Right. So, Dr. Deepika, many people think that, IVF process is a very painful process. So, what are your views on it, doctor?
IVF procedure, maybe it is called as painful, or people experience it in that way. Why? Sometimes because before conceiving, once you are undergoing the IVF procedure, I would just explain in a sentence or two what is IVF procedure. It's not, some people even think that it is something artificial. Artificial thing is being done inside your body. It's not artificial, it is just a biological thing. But the normal process of conceiving, which includes a egg and a sperm meet to form a baby, and then the baby grows in your uterus. So this meeting or the fertilization of the egg and sperm, it does not happen inside the body. However, it happens outside the body, in vitro. The full form, in vitro fertilization, that is happening inside a test tube, inside a petri dish, in the lab. And then that baby formation or the embryo is being transferred inside your body, inside your uterus. This is the gist of IVF procedure. So only this is different because we are doing certain things, and changes in the formation of the egg in your ovaries or sperm production, and this would increase your chances of pregnancy. So this is only the different procedure. So complication or the pain arises mainly why? Because before the this procedure of fertilization, the ovum pickup, taking egg outside your body, it requires stimulation. The first the ovaries have cyst formation, and then from the cyst we take out the eggs. So first, it is hardly for 9 to 10 days that the injectables are to be taken daily. This is one thing, but that is only 10 days, and that's it. After 10 days, after the transfer of the baby, it's not necessarily being injectables every day. Definitely, there are painful injections because they are given intramuscularly, like on your bum and everything. But
Yes.
again, it is not daily. Sometimes it is being done every 5 days or 7 days. Then we make it even every 15 days. So these things can be painful, but again, as I said, it is a very short duration. It is not a whole period. It doesn't go through like a painful procedure, or you are doing undergoing any extra procedure for the same.
Right. Dr. Deepika, very commonly, it is heard that people think that IVF pregnancy may result in abnormalities in child as well. So, is it true, doctor?
Yes, the same thing as I explained, now that they feel that something is artificial, artificial is being done, or there was some artificial baby formed in the laboratory and you have put inside your body. It's not like that. Having congenital or abnormal baby definitely depends on the genes of the person, that the genes inherited by the father and the mother. And then if there are some abnormality within them itself, there are possibilities, and that there is say, similar possibilities in case of a spontaneous conception or normal pregnancy also, in case it is inherited. But there are n number of tests which are during the pregnancy itself. That is, in the first 3 months, we call it as aneuploidy screening, anomaly scan, the sonographies and blood tests, which are available to test if the baby is growing fine or not. Just checking the heartbeat is not important. As I said, there are extra tests also required, but these tests makes it possible for us to see there is no possibility or there is no risk for the baby carrying any congenital abnormality or genetic abnormalities. So
Yes.
it is nothing like that. The baby would be abnormal. Possibilities are there, very rare possibilities, but those are checked, and there are similar possibilities in case of normal pregnancy or being in IVF pregnancy.
Right. And in the same line, doctor, many people also think that, after having IVF pregnancy, they will be blessed with twins or triplets. So, how much
Yes,
true is this, doctor?
yes. Twins, triplets, or we say it as call it as multiple pregnancies. These are why people see that commonly there are very rare possibilities of having twins or triplets spontaneously also without any medication. Once you conceive, there then also there are chances, but rarer. But when it comes to treatment, infertility treatment, as I said, there are you have to produce more cysts inside the woman's body, because we have to try to get more eggs out of the oocytes from the ovaries. So we cannot just rely on single cyst, which happens in a normal pregnancy. So we have to multiple the chances, because you are doing extra treatment. So whenever we stimulate the ovary, there are possibilities of overstimulation, or not even overstimulation. There would be more than one formation of the cysts, and then every cyst yields a egg. So again, while transfer of the embryo, you want to increase the possibilities of the patient to conceive. So sometimes there are two embryo transferred inside the body of the uterus, because sometimes patient has already passed 15 years, 10 plus years, 15, 20 years sometime out of their marriage, and still never conceived. So you want to increase their probability. You don't know whether both the embryos are going to grow, or out of those two embryo transferred, only one is going to grow. So that's why usually just two embryos are transferred. Sometimes single embryo is also transferred. There is never transfer of more than two. So sometimes there is possibility that both start growing properly. So a person has a twins. Sometimes, for some reason, there is already division, spontaneous division inside one of the embryo after transfer also, and that can result in a triplet, or sometimes quadruplet, that is more than three, like four pregnancies also. But there are certain procedures again done during the pregnancy itself, that you won't let. There are possibilities that twin pregnancy can go inside the body of the patient, and you can deliver twins baby also. Normally not very complicated, certain precautions taken, then it is a normal pregnancy. But more than two pregnancies are usually complicated, and you cannot expect the growth of all the three or maybe all the four babies inside. So there are certain procedures which are done during the pregnancy period also, so that you can properly let the two babies or two fetuses grow if they are growing. But it is not 100% that you are going to conceive into a twins or triplets after IVF pregnancy.
Okay. Dr. Deepika, is it true that a lot of hospitalization is required for IVF pregnancy, and once a lady conceives, then she has to be on bed rest for whole
Yes,
9 months? So,
yes,
how
yes.
much true is this, doctor?
Yes, that's what as I said, no, that they just feel that IVF pregnancy, okay, that here's it, that once the embryo is transferred, that's it, you are confined to bed for the next 9 months. It is totally baseless, not at all not at all scientific. You don't have to. There is, as I said, only frequent follow-ups. The frequency of the following up with your doctor, with your consultation increases. Nothing comes to hospitalization unless and until you face any complication. So there is, again, as I said, only if you arise into any complication, for example, which are slightly commoner in an IVF pregnancy, like even after conceiving, even if you get a positive pregnancy test and your sonography also shows properly growing fetus, but there are possibilities that your uterus is not responding to the medication, and you can have bleeding, called as threatened miscarriages, bleeding or spotting, even though the baby is growing inside, but you can experience bleeding, spotting, or pain before, like in fourth month or fifth month also. As I said, in twins pregnancy we have to be more cautious. So there are possibilities that this labor pain, which usually happens by eighth or ninth month, these people, because of twin pregnancy, can have it at fifth month also. Or there is leaking of your water around the baby starts leaking. These complication can happen, and only in these cases you require hospitalization and extra care. And then your doctor would advise you that if you experience this kind of spotting or bleeding, then you have to be on bed rest for a certain time, once you stop, till you stop bleeding or till you stop having spotting. But this complete bed rest for the whole 9 months is never advised.
So,
unless you
doctor,
face the any complication.
does whatever you are talking about, like spotting and having
Yes.
some bleeding and all, so this can happen in natural pregnancy as well,
Natural
right?
pregnancies also, but
Yeah.
in these pregnancy the possibilities increases as compared to a normal pregnancy.
Okay.
But again, as it is applicable to both. If you experience any complication, you would be hospitalized, and it is not for the whole 9 months. Again, it is just for the till the problem is corrected.
Dr. Deepika, how much important it is to choose a right gynecologist for IVF treatment? This is a very
Yes.
important question I
Yes,
would
definitely.
like you to
That
answer.
is actually a very important thing to know. As I said, people are extra cautious also on one hand that you are conceiving after treatment, even being not an IVF treatment, but certain type of infertility treatment or even IVF treatment. So people are all with eyes and ears. They are all to us till the pregnancy test is positive. They would come n number of times even if you are about you are being told about a later follow up date, but they would still start coming to you each and every time. This is from our own experiences. But once you get a pregnancy test positive, they feel okay, this is it. This is where this is the time when you required the doctor's consultation. Now we got our pregnancy test positive. Now there's no need for visit the doctor regularly, or sometimes no need for the doctor to for us to go to the hospital. We can consult a nearby place. That nearby place could be even a PHC or a CHC where you don't have a there would be a doctor. I'm not saying that, but it could not be a obstetrician or gynecologist. A specialist might not be there, and just a checkup is possible. So they would still go there because they feel the pregnancy test positive or conceiving is enough. Now the 9 months are okay. We can relax about it. But it is not like that. As I said, precious pregnancy,
Yeah.
extra
So,
caution, extra
yes.
medications, uh, extra not extra investigation, but additional investigations, and some frequent follow-ups as compared to a normal pregnancy is required with the IVF pregnancy. So better to choose your at least a consultant, a specialist of obstetrics and gynecologists, as well as amongst the obstetrician and gynecologist also, better to go for those people who have this experience in treating IVF pregnancies, because as we have discussed that IVF pregnancies, there are possibilities of more possibilities of some complications, or possibilities of multiple pregnancies. So we have to go to a person who has experienced all these things, who is consulting and treating the IVF patients. Like there are infertility centers also. So better to consult at that place, and not to think that once the pregnancy test is positive, there's no need to go to your doctor from where you are taking the infertility treatment. Nothing like that.
Yeah. So, Dr. Deepika, you are suggesting that not only choosing a gynecologist or IVF specialist for getting pregnant, but also
Yes.
being, in touch with your doctor till your delivery time.
Yes.
So, that is the message. I would request all our viewers to post their queries till the time we are having further more discussion with Dr. Deepika. At the end of the session, I will be taking up all the queries, and Dr. Deepika is there with us. She will be able to answer it in a more clear way. So,
Yes.
Dr. Deepika, along with that also, like we spoke on doctor's role. So, what is the role of family, of that couple who is undergoing that IVF treatment?
IVF treatment, yes. See, in our society, in the family itself, actually, infertility, not able to conceive, is itself considered as a taboo. Everyone agrees, because people don't even want to disclose, but they are under so much of pressure that after marriage, a couple is not having a baby for 1 year, 2 year, and then even sometimes even after a year also, there are talks all around inside your family, amongst your relatives, or in fact among the neighbors or people around you, that what is the problem, how there is no baby. That puts a lot of stress already amongst the couple. Then getting the treatment, again there is a problem. It is completely your decision to disclose it to the other people or not, the couple's decision. but I try to make it a point to explain the couples that there is no harm in going undergoing IVF treatment, or there is no need for hiding these things, because uh, this is nothing abnormal. You are not able to have baby naturally. That's why you have undergone some treatment. So it is any type of treatment is just a treatment. So in case if you are having fever, or you are having a stomach ache or headache, and then of course there are certain home remedies, and if doesn't work, you are going to get a medicine, right? And you will be relieved with that. So there is no harm in that, taking that medicine or taking some treatment. Similarly, it is like IVF treatment is similar, that has helped you to conceive, which was not happening naturally. So not to consider is as a taboo, like the family members other than the couple, the husband and wife, they have to normalize these things. That firstly, as I said, ki firstly to understand that this is a natural process, done with extra treatment, or adding certain things, and it is not an artificial thing. They start thinking that you undergone a IVF treatment, so there was some artificial thing done inside your body, so it could be an abnormal one. Or there are different talks also at some level, that I have not discussed this, but there are certain problems also. There is a certain problem with a female or a male, that is, the ovaries are not able to produce eggs, or the oocytes, or the sperm production inside the male is not proper or up to the mark, or we call it sometimes as azoospermia, that there is no sperm production at all. In these cases, we need to sometimes take donor eggs or donor sperm. They are from the sperm bank or the oocyte bank. So this also have to be done sometimes, as there is no production inside the body. So what, there is no harm, that there is no abnormal fetus or abnormal baby is going to be formed. Or you don't have to, it is, as I said, you don't have to disclose it to everyone, because getting the baby, or once you have your baby, the baby is not going to go, or the after growing up, that person is not going to go and get himself checked whether I am the I am the genetic I have the genetic background similar to my parents or not. This is also certain people, that, oh, you are taking donor eggs or donor sperm, that now that would affect the baby is not carrying our genes. No, you have yourself reproduced the baby, you have given birth to the baby, so it is completely your baby only. But these things were required to assist you, because you are not able to your body was not able to produce the gametes. So that's why
True.
the family has to understand that you have to stop considering this treatment, infertility as well as the infertility treatment, IVF or any other treatment, as a taboo, rather than normalize it, as it was just required as an assisted. That's IVF's other name is assisted reproductive technique. This is an assistance that we have provided.
Yes. So this assisted reproductive technique, doctor, we all know, doctor, IVF is a boon for couples who are unable to conceive
Yes.
naturally. So,
Yes.
doctor, at the end of the session, how would you like to represent IVF treatment in your own way, and how it is really a boon for all those couples who are having a desire to have a kid?
Yes, sure. As we were discussing, the infertility itself is a very big stress on the couple, because even many couple, from belonging to any background, any city, village dwellers or a city dweller, everyone, just couple gets married and people start talking about that, when are you going to get a baby? And once you are not able to, sometimes you don't plan it for 1 or 2 years, and nowadays with working couple, they, after marriage, they don't want to plan for a baby for sometimes 2 years, 3 years, or some things like that. But once you started it and you are not able to conceive it, so we usually advise that once you have started to plan about pregnancy, you have started to plan about conceiving, and then if you are not able to conceive in the coming 12 months, like 1 year or 12 months, and those for couples who, nowadays, as late marriages, plus 30, one or the male or female are like 30, 32 years, also get married, as it was previously the age group was 20 to 25, now it has become 30 plus also. So for those couples, I would suggest that if your age is already 35 or more, and then you are planning for conceiving, and then you have tried for conceiving for 6 months, and then you are not able to get a positive result, then you are supposed to consult your doctor, which is completely normal. And there are, before going for an IVF treatment, according to the cause of your inability to conceive, there are other treatments also which helps you. There are certain medications or ovulation induction we call. Then above that would be intrauterine insemination, IUI. These tests or these medications or treatment are also available for treating your infertility, helping you to conceive. Sometimes if this doesn't work, or sometimes the cause of the fertility, as I explained previously, that sperm production is affected or egg production is not possible, in these cases only where IVF is required. And IVF, as the advances are already on, have happened already, and there are certain advances already going on in this field of ART, assisted reproductive techniques, that it has definitely considered as a boon, because there are certain couples with unexplained infertility also, that there are, overall there are certain things normal amongst the patient, there is no particular problem, but still they are unable to get a positive result even after the basic treatments. So then also the role of IVF or ART comes there, and this would increase your probability of conceiving. But the only thing that we try to tell each and every patient coming to us for fertility, for conceiving, the infertility treatment, or the treatment that helps you conceive, is not 100% treatment. 100% as in a guaranteed treatment. For example, if you come to a doctor for a cold and cough or a fever, you are going to get a medication or sometimes antibiotic for 3 days or 5 days, and then you are expected to get relieved of the symptoms. Okay, so here, conceiving is, you are not suffering from any illness. You came to us for not able to conceive. So getting positive pregnancy result, there is no 100% guaranteed treatment. These, as the name itself suggests, these are assisting your reproduction. These treatments are assisting you with conceiving. So these increases your chances of being pregnant, and infertility has increased at 40 to 45% chances are increased than the normal conceiving of pregnancy. But nothing is called as 100%, because certain individual body is, as the individual body is different, the treatment response is also different. But definitely, as we have come through these, being in 21st century, what people used to suffer previously, and end up having no progeny, no baby of their own. Sometimes, like, even they become married for they are married for 20-25 years, and already being crossed 40 years, 45 years, not able to conceive, and then they lost hope and they stopped thinking about it. But with the advance of IVF treatment, now it is still possible that even the age of 45, even the age of 45, 48 also, a female can conceive with the assisted reproductive technique.
Right. Thank you so much, Dr. Deepika, for elaborating us on the topic itself. Dr.
Yes,
Deepika, I would like to take a few questions which has come
sure,
up
sure.
from our viewers.
Yes,
Uh, Doctor, one viewer from Ahmedabad is asking that I got conceived through IVF treatment. I'm 3 months pregnant. Can I carry on with my daily routine and walk, or I require bed rest? The same thing, doctor, which
yes,
you
yes,
mentioned.
yes. If already being 3 months, you must have undergone certain investigation. The sonography is done, where you are told that you are carrying a healthy baby, and the heart rate and everything is fine, and there is no complication, added complication that you might have experienced. No bleeding, spotting, pain in your tummy, anything like that. If there is no symptoms like that, or no signs like that, you can definitely 100% carry your daily activities inside the home. Heavy weight carrying, bending and doing continuous work, that should be avoided. Coming to your job, no need to stop working, or take a leave from your job, nothing like that. If it doesn't carry a to and fro travel for more than I would say 15-20 kilometers, like within an hour. If it is a within an hour you are able to reach your workplace, and the same thing coming back, that is more than sufficient that you can go and work. And if it is a sitting and not a strenuous work for you, that it does not require you to stand for longer duration, it is completely normal for you to work as well. Even if you are working and at home, you can do your daily activities very much normally.
Okay, Doctor, another question is there from a viewer from Bangalore. She's asking that I have undergone IVF treatment for 3 cycles. Till
Yes.
now, I have not got any positive result, and it is painful. Should I continue this or should I change the doctor?
Yes, as I said, we just discussed, right, that this is not something 100%, okay, that you have undergone the treatment and you are 100% guaranteed that you are going to get a positive result. Yes, there are a problem, like there was certain type of problem with the inside the body which has not made you conceive till even after 3 cycles of IVF. There
Yes.
would be options for first to find the cause. What was the cause? Sometimes it is, as I said, either with the egg or sperm production. So type of IVF might can change, and you can have your probability of conceiving and increase your chances of conceiving by changing the type of ART technique. Or there is sometimes inherent problem with the uterus or the response of the uterus to the baby, the transferred embryo. The environment inside the uterus is not perceptive for the baby. So certain medication changes or changes with the technique of transfer can help you to conceive. But the third thing, that after finding the cause, if there are certain things that as I said, there is problem with the uterus only, the environment inside the uterus is hostile and it is not responding to any type of treatment, then we have to understand that. And we just don't unnecessarily give hope that, as the person might have asked, that should I change the IVF center. The IVF center, you must be already consulting, is doing their best for you to get a positive result. But if still not possible, I prefer not to add on any unnecessary hope to the patient. If you are not responding, there are certain issues with the uterus that are not responding to the medication, then you cannot go for n number of cycles again and again,
Okay.
as being it is painful. Yes, injectables are taken, and extra, it is the monetary issues also, that the expenditures also add on. So if it is not responding, we have to understand the cause, and the cause is also detected and still there is no response to the treatment. We have to move further. There are still options for surrogacy, and another one where it includes the transfer of the baby formed by your gametes, egg and sperm. But then the embryo, because of the environment inside the uterus of the patient, was not good. So a surrogate uterus, a surrogate mother is can be considered a surrogacy option, or the last option would be adoption. But these things has to be considered rather than going for n number of cycles again and again.
Yeah. Dr. Deepika, one more question is there from Indore. She's asking that I am pregnant and I have undergone IVF treatment. Is there particular diet which I have to follow for IVF pregnancy specifically?
Yeah, the diet is nothing different. Trimester wise diet, I always suggest to any patient that first trimester you have a certain nausea, vomiting add on, and which is natural in a pregnancy, being an IVF or a normal pregnancy. So you have to avoid certain foods in the first trimester, being oily, spicy foods, and not able to have your food at once, as you are not able to finish that much of amount. Then you can make it a frequent meals rather than having a normal three major meals that a normal individual takes. You can take a frequent meals, but there are nothing avoidance during a IVF pregnancy, that no, this is your IVF pregnancy, so these number of foods you cannot take, or you are not supposed, these foods are harmful, nothing like that. You can have all the food, just avoiding certain spicy or oily food, but other than that there is no restrictions as particular for IVF pregnancy.
Okay. Thank you so much, Dr. Deepika. If we will be getting further queries from our viewers, I will be definitely
Sure.
coming in contact with you.
There are
Uh,
certain things I would like to add on also.
yes,
Once we were
Dr.
talking about the myths,
Yes.
just to add on one or two, that as I was saying that touch and everything also, they feel that it was going to harm the baby, so that also affects their well-being somehow. Other than that, there are certain more myths. They feel that computers, laptops, cell phones, or any electronic appliances in your home or around you can have a harmful effect on the baby. It's nothing like that. Computers or laptops have proven to be safe for the pregnancy, or they are not going to affect it. Even the microwaves or any other type of kitchen appliances or any electronic appliances in your home, they are not harmful if they are in a proper working condition. There is certain for example, refrigerator or microwave, if they have any problem, then only there would be some leak of certain radiation. So we have to be cautious just about that. Similar with the cell phone, of course you have to reduce your screen time. Otherwise, better to go for a I would suggest that go for a book reading, or much more with the better part with the book reading, rather than go for a screen time, just having time on your phone, or scrolling through your phone. But it again, it is not going to harm the baby. The another thing is with the get revealing the sex of the baby. Not revealing, in our country it is against the law. It is illegal to reveal the sex of the baby till the delivery, and it was mandatory because of the sex preference, and then female feticide and everything. So people start doing what they start doing is they predict the sex of the baby, whether it's going to boy or girl. So they say that if you are a craving for sweet food or sweet preparation, then it would be a boy. Or then coming to, if you are craving for spicy or uh, spicy or hot and spicy food, then it would be a girl, something like that. Or another thing is like either your baby bum is very high enough, it looks higher, the protrusion is on the higher side of the body, it would be a girl. And if the protrusion is on the lower side of the body, the bum is more on the lower side of the body, it would be a boy. It's again nothing like that, because finally it depends on the muscle tone of the abdomen. In the first pregnancy, in primary patients, the muscle tone is high of the abdominal muscles are more toned, so the bum definitely feels on the higher side. But in your subsequent pregnancy, in your second pregnancy or third, sometimes the muscles become slightly loose, the tone is lost, so the bum appears to be on the lower side. That's it. So everything has a scientific basis. So try to find out that before start following anything. Thirdly, there are certain myths I would like to add during for labor also, for delivery also, or as we were discussing, the people think that cesarean delivery is mandatory for IVF pregnancy sometimes. I would say it is not mandatory. Considering a precious pregnancy, we tend to have a complication, as I said. The complications are somehow more often as compared to your normal pregnancy. So, if there is a complication like twin pregnancies, even in twin pregnancies, the positioning of the baby is different. We say the baby is on the baby is upside down, called as breech presentation. Even if it being a single or twin pregnancy, the normal labor is not tried in that case, or there is low lying, the placenta is on the lower side, or the water level is less around the baby. In these cases, only where there you have to go directly for cesarean. But in cases of IVF pregnancy, when we consider it as precious pregnancy, we tend to have a lower threshold for cesarean, I would say, that we give sometimes a short trial of labor, but it is never avoided that no, you have considered with an IVF pregnancy, so it is mandatory for you to undergo cesarean. So there are certain myths around labor also, that once a patient is in labor, they are asked to have a sweet made full of ghee, or are given just plain ghee to drink. And I've seen that people, I have heard that, and I have patients asking me certain things also. But this is completely harmful for the patient. Why? Because during labor, patient is already exhausted.
True. Very true, Dr. Deepika.
Patient is on bed.
Yes.
They are not able to digest that heavy food. The ghee is a heavy thing, or a sweet preparation is a heavy thing to digest. So that might make you puke, as the cervix is dilating. Already you feel nauseous, and you would vomit more, and you would get more exhausted and dehydrated. It is already harmful for you, as well as in cases when there is emergency arise, baby's heart rate start dropping, or any other abnormality happens, where you need to go for emergency cesarean delivery, but you have just consumed heavy preparation, then there are increased risk of aspiration for your food to come from your food pipe to your air pipe. So in that case, this might the emergency might need to wait, because you have just consumed the this high residue food. And thirdly would be like, uh, this abstinence. The abstinence from sexual activity is required in the whole 9 month. Being a normal or IVF pregnancy, it won't be like that unless and until there are certain complications we've discussed previously: pain, preterm pain or premature pains, or spotting, bleeding, low lying placenta. In these things only, the doctor would be advising you, your consultant would be advising you to abstain for certain time. Otherwise, after first trimester till, I would say, 30-32 weeks, it is normal to have a routine sexual activity.
Yeah. Thank you so much, Dr. Deepika, for explaining us on the topic so elaboratively and in such a simple way, Doctor. It was really impressive, ma'am, and I hope that all our viewers might have got, to know more and more information about, facts related to IVF pregnancy. And Doctor, you tried to burst out most of the myths which are
Yes,
related to IVF pregnancy, and this will be really helpful for not only the couples who are thinking to go for IVF pregnancy, but also for people, couples who don't even want to go. They can actually, tell it to their relatives or somewhere, and it will not only affect the couple but also to the whole family.
sure,
Uh,
sure.
Thank you so much, Dr. Deepika, for
At
being
last, I
here.
would just add one thing, just
Yes,
a phrase made out of coming to many people like that, many queries like that. I would just add that, listening to listening to a next door elderly aunt, or listening to your family member about all the things is okay. It's okay. You can listen to them, but you have to be cautious which things to follow and which things to not.
right. Because nowadays, doctor, the lifestyle as well as our diet and everything has been changed.
Sure.
So things which were actually acting some years before might not be
That's
acting
right.
now.
Yes, yes.
So thank you so much, Dr. Deepika. And with this, I would also like to thank to all our viewers as well. Once again, on behalf of Puberty to Menopause, a women health awareness initiative by Human Biologicals Institute, I wholeheartedly thank to all our viewers as well who are being with us in each and every show. We request all of you to visit www.pubertytomenopause.com for more information on various health aspects of women at different stages of life, and also follow us on Facebook, Twitter, Insta to get more updates on health as well as live talks with the expert doctors across the nation. Till then, choose better nutrition, better lifestyle, and build your fitness. See you all again in another interesting topic of discussion on We Talk to You. Thank you.